In part one of this autonomic nervous system series, I mostly covered the pathophysiology and to focus on the parasympathetic response to tease out the importance of its effect in each organ and thereby remembering how it can affect each organ when we're in a rest and digest mode as against a flight or fright response. I think you'll appreciate this large mnemonic that was there in the previous handout, but make sure you review that again before you come into this part two. As far as anticholinergic drugs, I told you that cholinergics are acetylcholine blocking agents, right? So if you have acetylcholine and you're going to give an anticholinergic effect, it's going to make the person have an opposite effect, right? So when you give an anticholinergic effect, you'll have the opposite of the parasympathetic response. So let's say let's see when we would be given. So if you remember from your sympathetic response, right, the heart rate would be increased. Whereas when you have an anticholinergic, it'll be the same. Does it make sense? It's kind of like a double negative if you want to remember that way. So if you want to give an anticholinergic, you would give for patients who have decreased heart rate, who have tremors, muscle problems, rigidity, because it helps to relax them, right? And then it could be given when people have respiratory secretions, like in asthma or COPD, because what can anticholinergics do? They can bronchodilate, similar to the sympathetic nervous system, right? And then if somebody has GI upset or hypermotility or irritable bowel syndrome, what it can do is it kind of dry them up, just like the sympathetic response. It could increase, it could treat the hypermotility by decreasing, because when you're in a sympathetic response, it's a flight or fright response. You would not want your GI to move, right? So these anticholinergic kind of mimic exactly the sympathetic response. So if these are the indications, what do you think you should be careful for when you give these? Right? Anytime you think when you want to give for these medications, any medication, you may want to think of what will happen if you give a little bit of excess of these, right? So let's look at the side effects. So if you give excess of sympathetic, it's exactly what will happen. There will be severe pupillary dilation. There will be increased intraocular pressure. So we should be really, really careful to give when patients have glaucoma, because glaucomas increase intraocular pressure, right? And then people can have urinary retention. Now you're going to go to the opposite side, right? And they could have severe decreased motility. They could have paralytic ileus, or they could have severe vomiting because they're so, like the secretions are like all affected. Then they could have tachycardia, right? Severe increase in heart rate. And then you could have severe bronchodilation as well. So we have to be careful when we give these medications. So think about when are the times when we would give these and then try to connect to that. If you look at the mechanism of action, these anticholinergics block or inhibit actions of the acetylcholine. Okay, that's the most important effect. And then other side effects include they could have decreased salivation, they could have decreased lacrimation, decreased urination, um, and so on. I think that should not be hard for you to tease out from the mnemonic sludge. Um, so what are some of the drugs? Atropine, if you look at it, it's usually used for tachycardia in cardiac units. That's pretty commonly used when patients go into severe, bradycardia. Did I tell you tachycardia? Sorry, severe bradycardia. You want to increase the heart rate. You will give atropine, and then atropine is also given in severe diarrhea. Scopolamine it's usually a patch which is given to post-op patients when they have increased secretions in the GI tract. And then oxybutynin is given for urinary retention. Benztropine, we saw this drug when you did anti-Parkinson's drug, remember, because of the cholinergic effect, anticholinergic effect. And then dicyclomine bentyl is also given for severe nausea, vomiting, and diarrhea. So caution against sludge with dry mouth and hard candy should be recommended, asking them to drink enough water and fluid, avoiding high temperatures because you're already dry, the patients are dry, and ask them to report if the heart rate goes really, really high because you're giving it to treat tachycardia. Now they could have severe tachycardia, right? Sorry, bradycardia, and then you have tachycardia. Be careful. It can be given in patients with glaucoma, especially narrow angle glaucoma. I hope this helps. I'll cover the next group in the another part 3. Thank you.